The House is set to vote on a proposal that makes it easier for people to know their health care costs up front. This bill requires hospitals and other health care centers to publicly list prices. Washington correspondent Samantha Manning joins us live from D.C. today. And Sam, this comes down to making sure customers can compare those prices.
Yeah, Michelle, the problem is that many people don't find out their true health care costs until after they've already gotten the care, right? So this proposal is meant to make sure people know the cost up front so they can shop around for the best price.
It's not always easy to figure out the full cost of hospital care and medical labs before you actually get the service. Now there's a bipartisan push in Congress to change that. It's called the Lower Costs, More Transparency Act.
This is about making sure that families have financial security and that the squeeze that they're starting to feel between their family budget month after month, that they have more insight into being able to plan.
Here's how the proposal would work. It requires hospitals and diagnostic labs to publicly list the prices of their services. It also adds new rules for the so-called middlemen, known as pharmacy benefit managers, or PBMs. It requires PBMs to give employers detailed information on prescription drug spending.
It's nearly impossible for people to plan ahead and budget their health care cost.
The lack of transparency makes it difficult to compare across providers.
But the measure is facing some opposition. The American Hospital Association sent this letter to House leadership, writing concerns about, quote, added regulatory burdens on hospitals and health systems. The group cautions that not all healthcare sites offer the same levels of care or services, and therefore prices can significantly vary. There are also some House Democrats who say the measure is missing key elements. They argue it should include more transparency with private Medicare plans and private ownership of healthcare facilities.
And this bill needs a 2/3 majority in order for it to pass in the House. Right now, it's unclear if it has enough support to make it through. Reporting live in Washington, D.C., Samantha Manning, KIRO 7 News.
All right, thanks, Sam. Congress is back at